To represent Brighton, Arundecoit, and parts of the city. And the last few years, before I was Majority Leader, I was the chairman of the Assembly's Insurance Committee, which doesn't do Medicare, because Medicare is a federal program, not a state program. But we would get many questions about it, and in particular, my mother, who may be in the crowd somewhere in the sea of people, who's very good with insurance, very good with it, should have been in insurance going into the profession, would ask me questions every year when she would get the forms, and we would go through the various options, which I have to say were more confusing than I expected they were going to be. But obviously, which option you choose is an important one, both for your family budget and if something happens during the course of a year or two, sort of try to figure out a plan that would suit your needs best. So after having gone through this a couple of times, I thought, well, you know what? We should do a little forum for folks who may have questions, who are either dealing with Medicare for the first time or because they may be selecting different options as time goes on, maybe selecting for a second, third, fourth, fifth time, etc. So I asked a group of folks to join us this morning. It's important to note that this is not an opportunity to sell Medicare options. We'll go through the options, and we've asked some experts from the industry to join us to answer questions, but I just want to stress, this is not because this is the government and we're here to help. We do not sell insurance, so these very nice people who have agreed to join us will answer questions, and no doubt, if you have questions afterward, you want to hang around, we'll be here as long as people would like to be. I do want to just, as I said, Medicare is a federal program. There are about 52 million Americans who receive Medicare as of 2013, the last year that we have data for, including 43.5 million people age 65 or older. Some additional nearly 9 million are on Medicare because of some disability or disabling condition. So I asked this group of people to come. Ron is from Lifespan. Are most of you familiar with Lifespan? It's the largest not-for-profit agency that deals with aging and senior services throughout our region. They are wonderful, wonderful people to deal with. If for other reasons unrelated to Medicare you have questions regarding elderly services, you should feel free to call Lifespan, and I'm sure Ron would be happy to give the number, because I don't have it off the top of my head. Ron, I should.
It's on their handout.
Oh, good.
244-8400. It's on the front of your handout.
244-8400. Joining Ron from, and Ron's going to give I hear about a 15-20 minute presentation. Is that right? Longer? Half hour. Okay. Half hour presentation. And then we do have a number of folks from the industry. As I said, Jennifer Neary from Aetna. Sue Henning is going to be on the panel from Excellus. And she's also joined by Yvonne Donnelly, who's going to be joining as an observer. And from MVP, Mr. Paul Richardson. Now, obviously, there are many other providers. So, again, we're on a stress. We're not selling it, but we asked 3 people who are representative of the industry to talk about different options. There are many others. You see television ads right now because the open enrollment period began October 15th. It ends on December 7th. So you have until December 7th to select the option that you would want for yourself. I know in the case of my mom and dad, they had 2 different options they selected because of their various health conditions. My mother sort of went through and made judgments about where each of them would be. So again, thank you for being here. I really do apologize. I guess this is an embarrassment of riches that so many people showed up, but we will try to accommodate everyone. And if someone didn't get a packet, as I think Tad said, we will be happy to send out, if someone just leaves their address and indicates that they would like a packet and didn't get one, we will certainly be happy to send it out to you. So again, thank you. Happy Monday. And Ron, it's up to you.
So the question is, did they all show up for you or for me?
Not for me.
Morning, everyone.
Morning.
Nice to see all of you. I brought these packets, and I said I brought about 150 of them. I'm scheduled to do another presentation later this afternoon, which is scheduled as a 2-hour presentation. This is scheduled as a half hour. This is an overview. So I have materials in my car on the 2-hour presentation, so if you didn't get this material and want the longer version, stick around and I'll be able to provide you with the longer version afterwards, okay? All right, so if you open up that package, on the right-hand side will be a copy of the slides that will be up on the screen. So if you're too far back and you can't see the screen, you can just follow the slides in front of you, okay? On the left-hand side are some documents that I call my reference documents, and I may refer to them periodically, so try to keep them where they are, and we'll get to them when we need to, okay? So, as Assemblyman Morelli said, we don't sell insurance. My job is to inform and educate. The arrangement is that this HICAP program, Health Insurance Information Counseling Assistance Program, that's run throughout the state. In every county, there's a HICAP program coordinator. And in Monroe County, the Office of Aging at Monroe County asked Lifespan to run it, and Lifespan asked me to run it at Lifespan. So I'm the Monroe County HICAP program coordinator. I represent Monroe County, Office of Aging, and Lifespan. I do not represent any individual insurance company. And I like it that way. I've never enjoyed selling. I prefer to give away whatever knowledge I have. Okay, so what I'm going to talk about are the two original parts of Medicare, which are Part A and Part B. Those are the parts that you get from the government directly. Then I will talk about the additional insurances that you can add to Medicare. Those are Medigap supplement plans, or, not and, or Part C Medicare Advantage plans. And then if you have the Medigap, you can add a Part D prescription drug coverage plan. Okay? At the very end, I will briefly discuss some plans to help the expense side of the cost side of providing for all of this coverage. But the main part of it will be up to Part D, okay? So, moving along. Original Medicare Parts A and B. Part A is your hospital, inpatient hospital stay coverage. That's not emergency room, and it's not observation status. It's inpatient hospital stay. That's Part A of Medicare. Part B, that's your outpatient coverage, all your medical and all your services at the hospital that are outpatient, okay? Then there's Medigap insurance. Medigap insurance works with your Parts A and B as a secondary insurance after Parts A and B have done what they're going to do. What's left of the bill can be submitted to your Medigap supplement insurance if that's what you have. Then, as an alternative to all of that, most people choose something called Medicare Advantage plans. Those are your HMOs and PPOs and a couple of other alphabetical soup type plans. Those are what most people choose to have, and I will be discussing those options in detail. And then a little bit about prescription drug plans for those who want to consider a prescription drug plan on its own. Okay, original Medicare. Original Medicare, I mentioned Part A is your hospital, Part B is your doctors and outpatient. Part B does not cover vision, dental, hearing, and routine checkups, or outpatient prescription drugs. The outpatient prescription drugs is what's covered under Part D of Medicare. And Medicare is accepted just about every doctor and hospital all over the country, okay? In detail, Part A of Medicare covers you for a even if that's all you have, it's just your Medicare card, and you have Part A of Medicare, you're covered for up to 60 days of a stay in a hospital, okay? I have to apologize. These are 2015 rates, but 2016 rates have not been announced by the federal government yet. They should be announced shortly, by the end of the month. It only gives them about another week, but they look like they're taking every last second they can, because there's an issue here that I will discuss later on the next slide. But on 2015, if you are admitted to the hospital and all you have is your Medicare Part A, you are responsible for the first $1,260. Okay, the bill could be $1,261, or it could be $12,000 or $120,000. Doesn't matter. You're responsible for the first $1,260 with Medicare Part A as your only coverage. If you're there more than 60 days, which is highly unusual and highly unlikely, there's additional co-pays that you can use, but I'm not going to spend much time on it because it's so unusual. But the last thing that Medicare Part A does cover is skilled nursing care. Skilled nursing care can be covered by your Medicare Part A if you met certain criteria. One, you have to have been admitted inpatient status to the hospital. Then you have to have remained inpatient status in the hospital for a minimum of 3 consecutive days. And then finally, on discharge, doctor's orders have to indicate that you need skilled nursing care for the purpose of rehabilitation. If those conditions are met, then Medicare Part A will pay for the first 20 days of rehab and pay in full. And if you need up to 100 days, they will pay, but you will have to pay $157 a day for days 21 through 100 as an additional copay. That's what Medicare Part A covers. You may have additional insurance that will cover more, but that's what Medicare covers. Part B of Medicare, and here's where we have an issue. Part B of Medicare is not free. It comes at a monthly premium of $105 a month, and that's what's up for consideration. As it's calculated right now, that could see an increase for next year to $160 a month. 160. However, there is good and bad news tied into that, okay? Because Medicare and Social Security are linked. And the law says that if Social Security, if Medicare goes up and Social Security does not keep pace, then you will not have to incur the higher Medicare rate. So since there's been no COLA, it's been announced that there's no Social Security, they could raise the Medicare rate as high as they want. You will not have to pay it, at least initially. Okay, anyone new to Medicare next year, if there's a rate increase, will have to pay the higher rate. But anyone that's already on Medicare and Social Security would be held harmless. That's the clause in the law, okay? Okay, so this year's rate, $105 a month. That's the same for anyone individual with an income up to $85,000 or married couples with joint income up to $170,000. If you earn more than that, then you are subject to a surcharge. And if you are subject to a surcharge as a high-income earner, you will not be held harmless. If the rate goes up, you will pay the higher rate, okay? And then there's an annual deductible. Once you have your Medicare, and if you have no other insurance to go with it, then you will have to spend the first $147 this year out of your pocket before Medicare Part B starts to contribute. Once you've met your deductible, then Medicare Part B will cover 80% for the rest of the year. That $147 is also scheduled to go up. If the premium goes up from $105 to $160, the deductible could go up from $147 to as high as $220 something, okay? And that deductible is not something that you would be held harmless on. Everyone would pay the higher deductible. I didn't make these rules, I'm just explaining them, okay? So please don't take it out on me on the way out. Okay, Medigap. Medigap is additional insurance that you can purchase to go with the Medicare Parts A and B that you get from the federal government. Is there anyone in this room that is not yet on Medicare? Oh, there's a bunch of you. Okay, well, everyone that's on Medicare gets a book like this. See, this is your policy renewal statement that tells you what you're going to be covered for next year. I have a bunch of these up front if you want to take one on the way out. Okay, so this is what your policy, and in this it tells you what's covered in Part A and what's covered in Part B and what's not covered. Prescription drugs are not covered when you're an outpatient. They're covered when you're in the hospital in the Part A, but not as an outpatient. So, if you want to supplement your Part A and Part B to cover those copays and deductibles, you can get a Medigap insurance policy that will do that. There are 10 different types of Medigap policies that cover different things and different levels, and I'll explain that. But they do not cover anything that's not in the handbook, so they will not cover prescription drugs. So if you get a Medigap policy and want drug coverage, you're going to have to add drug coverage as a separate issue, okay? So, the policies, and if you go on the, I think it's the left-hand side, third document in, left-hand side of my package, not of the, yeah, left-hand side should be the third document, and it should be a chart very similar to this. It's also in your Medicare and You handbook, okay? It's a government chart. It's not my chart. It tells you that there are 10 different versions of a Medigap plan that you can have. They are labeled with a letter, A, B, C, D, F, G, K, L, M, and N. The missing letters are plans that did exist but are no longer existing, and they don't like to reuse them. And down the left-hand side are the different aspects of the coverage that they can offer. This is, again, government mandated. The different benefits include your Part A coinsurance, your Part B coinsurance, your skilled nursing coinsurance, your Medicare Part A deductible, Part B deductible, and travel, emergency travel coverage. These are items that you can cover with a Medigap policy, and you decide which policy you want because the chart tells you which policies cover which items. If you want them all covered, you go with an F-lettered policy, okay? If you are willing to settle for slightly less, you pick the letter policy that suits you. If you turn my chart over on the back, you'll see the prices taken off the New York State Insurance website. The website is listed at the bottom of the page, okay? So that's how you determine how much they cost. But if you should choose a letter policy, and let's, for this example, choose a letter F policy, and you go to the back, you look down the column for the prices for the letter F policies, and you will see that they will greatly vary from company to company. From about $180 a month per person to more than double that. The thing is, they cannot vary in benefits. The benefits are locked by the government. So you can choose whether you want to spend $180 for that policy with one company or $360 for it with another. You're going to get the same benefits, okay? That's how it works. Okay. Most people don't go that route. Some do, about 10%. But most people go with the other alternative called Medicare Advantage. Medicare Advantage is your HMOs and PPOs mostly. These are plans that that works different than Medigap. With Medigap, the bill is first submitted to your Medicare, and they pay or agree to pay at least part of it, and then what's left goes on to the Medigap. With the Medicare Advantage plans, it works differently. When you sign up for an Advantage plan, you get a card from that plan, and you take your Medicare card out of your wallet and put it away in a safe place. What you do is carry the card from your Advantage plan. And that's the card you show whenever you're getting medical care, whether it's hospital, doctor, test, even prescription coverage. It's all built into one card. And that card is from the company that's responsible to pay the bill. Medicare is not going to pay the bill anymore. What Medicare does is monthly, they send money to that Advantage plan on your behalf. That's why you get bombarded with mailings this time of year, because the Advantage plans want the Medicare dollars that they will get if you sign up with their plan. Okay? It's a lot of money. I don't want to get into what it is, but it's a lot of money. And that's why you're in high demand to each of these companies. Choose wisely, okay? Anyway, each Medicare plan offers its own mix of products. And if you go to the next document on the left-hand side of my folder, after the Medigaps, there should be 2 pages on Medicare Advantage plans. Okay, I didn't keep any copies for myself to show you what they look like, but it's a very detailed chart, 2 pages, both sides. It says Medicare Advantage comparison chart, and it lists all your options for HMOs and PPOs in Monroe County. Aetna's on there, Excellus is on there, MVP is on there, along with a couple of others that are not as popular, including Health Now, United Healthcare, and WellCare, okay? They're all on there, and our chart puts it side by side. As my Polish friend likes to say when we hit our golf balls next to each other, side by each, okay? Right? So you can compare, column by column, the difference between each of those plans. Okay, you can see what they charge in monthly premium, what they cover, what your co-pays would be for different services, and you can evaluate based on your anticipated needs which of the plans will be best for you. You will find that some of these plans are still being offered at a 0 monthly premium. Okay? Aetna has one, United Healthcare has one, and Excellus is offering a plan, a new plan for next year called Select, and it will be at a 0 monthly premium. Now, that's important to note, especially if you want drug coverage, but you don't want to spend a lot of money for drug coverage because you're not taking a lot of drugs, but you want to just have something in place. Those 0 premium plans include drug coverage. So you're getting the drug coverage for free. So there's no excuse not to have some form of drug coverage. You can have it with one of those plans, okay? Now, I want to quickly explain the difference between an HMO and a PPO. And by the way, these letters are important and they're included in the names of the plans. The HMO is Health Maintenance Organization, and it is the strictest version of an Advantage plan in that they, in addition to requiring you to have a primary care physician, will require you to get referrals from your primary care to see specialists, and they will not cover services outside the local area, which they call where they have a network of doctors and hospitals that they have signed contracts with. And they will not approve you to go outside of that network except in the case of an emergency. Okay? If you're traveling and you are out of the area and you have an emergency, they will cover the emergency. But they will not cover you to go and travel from where you are to another area to get coverage. Okay? That's an HMO. A PPO A PPO is an HMO on steroids. It allows you the option to stay either local or to go outside, but beware, if you choose to go outside the local network, they have pre-established a different set of copays. Low copays if you stay local, higher copays, sometimes double, if you go out of the network. So it's your choice. They don't limit you, but they charge you extra if you choose to go out of the network. It's good for someone that may want to be a snowbird type person, live 3 months of the year somewhere other than Rochester. Probably not June, July, and August. Probably more like December, January, and February. But for those 3 months, if the person is willing to pay slightly higher co-pays, they have coverage, okay? So that's what that's intended for. And that's the difference between HMOs and PPOs. There's one other alphabet, a soup type name I want to put out there. It's called HMO-POS. If it says POS, what it's doing is trying to be somewhat of in between HMO and PPO. It's saying that we're an HMO, but for up to a certain dollar limit, which they call travel benefit, and it's at the bottom of my chart, up to the travel limit, they'll allow you to go outside the network without question. So that's a modified HMO, an HMO POS, okay? I don't have a lot of time to go into details on these because this normally is a 2-hour seminar and I'm trying to get it done in a half-hour overview. If you have questions on any of this, feel free to call us at Lifespan. I have 30 trained, certified counselors working with me back at Lifespan to answer questions, to call back on the telephone, or to meet with individuals who need to have a one-on-one session. So feel free to call us at Lifespan, 244-8400, extension 113, or my direct line is 287-6413. Okay. There is another Medicare Advantage plan option out there called PFFS. I don't discuss it much because it involves using doctors and hospitals that can opt in and out of the program. And for me, that doesn't sit well because I don't want to find out after I've gone to a doctor that he doesn't accept my insurance. I want to know that up front. So I'm telling you, they're out there. Be careful if that's what you choose. And as always, with any Medicare Advantage plan that you're considering, please make sure that the doctors that you want to see will accept that plan. Check that out before you sign up. Just call the doctor's office, they'll tell you, and that way you won't find yourself in a position where you've gotten into a plan and your doctors won't accept it. Because in that case, you're out of luck because your dollars from Medicare are going to the plan. And if your providers are not accepting it, Medicare is not going to pay the bill, you will, okay? So be careful on that. Okay, prescription drug plans. I got to wrap this up in the next 5 minutes. Prescription drug plans are needed if you're going with original Medicare alone or with original Medicare and a Medigap. You do not need and should not have a prescription drug plan if you're going to go with an Advantage plan because you have the ability to get an Advantage plan with the drug coverage built in, okay? If you're going to choose a Part D plan, then the way to choose is not the same way as you chose a Medigap plan. You don't look at cost, monthly premium. You have to have a list of the drugs that you plan to take, and you have to look up each of the drug plans and see if they cover your drugs and pick the one that does the best job covering the drugs you need. Now you can do that yourself if you have access to the internet. It's on the Medicare webpage, www.medicare.gov, or you can call 1-800-MEDICARE and they can do it for you, or you can contact us at Lifespan. If you have the list of drugs, we can help you pick which is the best plan, okay? And finally, Epic. New York State Epic, something I'm sure Assembly Morelli knows a lot about. Recently, in the last couple of years, the State Assembly approved increasing the income limits that an individual or a married couple can have and still qualify for Epic. It went from $35,000 for a single person up to $75,000, and from $50,000 for married couple up to $100,000, practically doubling. So, a lot more people are now eligible for Epic than ever were before. Many people say they don't qualify, they checked out previously. You got to check it out again. Epic is excellent. It's one of the best plans New York State offers for its seniors. With Epic, Epic is a secondary payer for your prescription drugs. It will work starting at whatever your primary coverage says is your copay and further reduce that. With Epic, the maximum you pay for a copay for a refill is $20. So it can be very, very helpful. Also, just by having Epic, if you find during the middle of a year that you are unhappy with the insurance that you selected, just by having Epic, you can call a new company and switch by telling them that you participate in Epic. It's a one-time-a-year get-out-of-jail-free card. So it's worth having, even if you don't use it for the prescription drugs. And there are two other programs to help financially. One's a federal program, one's a state program for low income. If your income as a single person is below $13,000 or a married couple below $19,000, there are plans to help pay your Medicare Part B premium and help pay for your prescriptions. If you or someone you know think you qualify, call us up at Lifespan, and we will help you, assist you to get enrolled in those programs. I think that I'm going to end it there and turn it back to Assemblyman Morelli.
Thank you. So, you can applaud Ron. We have a full house next door, so I'm going to send Ron over. I want to acknowledge John Gehring, who's here, who's our interpreter. We really appreciate him being here. And one thing I did forget, I forgot to thank Supervisor Bello in the town of Arundecoit for allowing us to be here, although I think the next one will have to be in a school auditorium somewhere. But we do very much appreciate them accommodating us both here and next door at Town Hall. So we're now going to have the three representatives, Paul Richardson from MVP, Jennifer Neary from Aetna, and Sue Henning from Excelis are going to come over. They've been answering questions for the group over there. They're going to come here. If you give us 2 or 3 minutes, we'll get them to walk over, and we're going to send we're going to send Ron next door. So hold on just a minute, we'll have them come over.
Hi everyone, how are you? I know, we're propping the doors open. It's been like a perfect storm, right? So I appreciate y'all still sticking with us. We're at our second portion of the program where we have the sales reps. And Joe will be walking around with a mic the majority leader will be walking around with a mic with regards to questions that y'all may have. We're propping the doors open, we're trying to open windows, so we will be working on that.
So I think I previously introduced Jennifer, Sue, and Paul. Again, John, thank you for interpreting, and we'll try to do this. I will ask. They have microphones. There's microphones, so this will be a little easier than next door where they didn't have microphones and we were just using voices. But why don't we do this? I'll try to get to everyone, and I'll try to mix it around, and I'm sure I'll be accused of favoring one side of the room or front or back, as there's no avoiding it. So, who has a question? I should have worn my Fitbit. I'll probably get a lot of steps here. I can see this is going to work for about 30 seconds and then not work any longer.
Hi. It's a question for Aetna. So is Aetna's PPO is in-network only local? In other words, does Aetna have in-network providers out of state?
We absolutely, can you hear me? Okay. Yes, we absolutely do. So we have a national network, and anyone that provides, any providers that participate with us in-network, you can utilize that in-network benefit anywhere else that there would be a national provider. So if you go to Florida, Georgia, California, Texas, we're all over the place, absolutely.
And when we're using acronyms like PPO, Preferred Provider Organization, I believe, from my old insurance days, but we should probably try to just educate folks on what those acronyms stand for.
To all three panelists, do your provider panels locally are inclusive of all of the doctors and all of the hospitals locally, or are there exclusions? Could you elaborate on that, please?
I'll begin. I can speak for MVP Healthcare. I'm not aware of any plans that are inclusive of all the providers, all hospitals. There's typically going to be some segment that are non-participating. In the case of MVP Healthcare, all of the hospitals in the Rochester, Buffalo, Syracuse, all the way up into the Vermont region participate. The hospital, the physician network in our care area runs right now at about 98% of the physicians. So there's some that do not participate, but the vast, vast majority do participate with us.
Hi. With Excellus Blue Cross Blue Shield, with the Rochester region, our service area is 6 counties large. So it's Seneca, Wayne, Yates, Livingston, Ontario, and Monroe counties. So within that service area, we have all of the hospitals participating in network and the majority of the providers. We do not have 100% participation. Like MVP said, it's probably not going to be that way with any carrier, but the vast majority are going to be in the network. We have thousands and thousands of doctors to choose from.
And yeah, I would just agree with what both the other panelists said. Always check with your doctors. Call your doctor, call the hospital, check with them, educate yourselves to find out. Check with the carriers, our websites. I know we all have provider directories online and doc finds, but always best to check with your doctor or your hospital first and make sure they're participating.
Hi. I currently have Medicare Part A, and I'm insured by my wife's policy at work. If I elect for Plan B, how would that affect a pre-existing condition? Pre-existing medical condition?
If you currently have insurance, you shouldn't have a pre-existing condition. I'm confused by the...
Well, if I go to Plan B and I have a pre-existing condition, would that be covered under Plan B, or should I stay with my wife's policy or not, I guess is what I'm getting to.
The nice thing with regards to pre-existing conditions is you opted to waive your Part B when it was offered to you at 65 in order to stay on your wife's employer group plan, correct, while she's still working. And if she's considering retiring or whatnot and you're deciding, you know what, now I'm going to add Part B back to the insurance, there would be no pre-existing conditions in that situation. That's a federal law. You don't have to worry about that. The other, just to emphasize this, and it's a little confusing, during open enrollment, October 15th through December 7th, you're allowed to migrate from Advantage Plan to Advantage Plan without any pre-existing conditions. The exception to that is known as end-stage renal disease, which means you're currently on dialysis. That's the one exception. But you literally could be, going through chemo treatments and switch in the middle of and during open enrollment. That would not have a negative impact on you for the coming year. Anything to add?
Before I take this question, I just wanted to acknowledge the Town Supervisor Adam Bello, who's hosting us here. If you could give him a big round of applause for being willing to do this. I would tell you need to build a bigger library, but that wouldn't be very popular right now.
If one opts for just Medicare, is there a copay for any service?
So the question has to do with what are the benefits under original Medicare and are there copays for services when you're going to the doctor? So I'm assuming Ron went over the different parts of Medicare, Part A and Part B, Part C and Part D. The Part A and Part B benefits, which are original Medicare, are found in a publication called Medicare and You. So you would want to write down the benefits that are important to you and look through that book, Medicare and You, and that's going to fall under your Part B, a doctor visit. So what you'll be responsible for is the Part B deductible and then the 20% co-insurance for the allowed amount for that service at the doctor. So that would be the place to look for all of your benefit questions under Original Medicare, is the Medicare and U-Book.
I would add, the one concern that I have for people who are on a Medicare alone, Medicare Part A and Part B, is you're predominantly responsible for 20% of your bill. The issue is Medicare has no out-of-pocket maximum protection. So that means that 20% would be paid indefinitely with no out-of-pocket maximum protection. That's the big risk with having Medicare alone and why these Advantage plans are so popular and so important.
Yes, one of the advantages of having the town supervisor here, he just turned on the air conditioning, so it should get a little cooler in here.
My wife and I both have MVP health insurance. Now, when I retire or my wife retires, I have in-home medical equipment. I have pacemaker, defibrillator, etc., and I have a machine that I have to sleep next to, which reads out my pacemaker and stuff every night. Will that be covered under the new system? It's now covered under the medical system with MVP. But will that in-home equipment be covered under any, Medicare or program?
Specifically to MVP, and it's probably the same for the other companies. I'll let them speak for that. Durable medical equipment, oxygen, a CPAP breathing machine, a reviewer of the pacemaker, those are typically covered at 80% under our programs. They are covered. A lot of times there's a rental basis for those, and you've probably met the rental portion already, but the general rule is durable medical equipment's covered at 80%. I can't speak if there's any difference.
That would be the same for Excelis, as long as it's medically necessary.
Correct.
And as well.
Any questions at the back of the room? I feel like I've been
This is regarding percentages. When they say you owe a 25% percentage, is that of the, how do I word this, the original cost or the cost to an insurance company? In other words, like for a drug, the original cost of the drug might be 130, the insurance company only allows 60. Are we paying 20% of the 60 or of the 130?
You're referring to prescriptions particularly, is that correct?
Not particularly, no. Percentages wherever they are.
I'll let Sue answer this one.
So when you are using a participating provider, and that provider has agreed to an allowable amount for the service, and you're responsible for a percentage of that service, the percentage that your benefit will fall under is the allowable amount, the agreed upon price for that service between the insurance company and the provider. You're welcome.
My question has to do more with the Epic and the extra help. If somebody's already getting Epic and or extra help, is it necessary to reapply for the new insurance year, or will it carry over?
Epic right now has a biannual recertification timeframe. That means every other year they want you to recertify, and they will send you notice of when that time is due. Obviously, there's no disadvantage to having Epic, so anybody that qualifies, I personally believe should qualify and go ahead and do that. But it's a biannual enrollment for that.
This is directed to all the representatives. This Medicare savings account, would you care to elaborate on that? Does any of your companies offer it yet?
I can speak specifically for MVP. We're not going to talk about products in this forum, but MVP is offering a Medicare savings account for 2016, and you'd want to come to one of those individual meetings or the group meetings to discuss the specifics of that style of plan. It's a fairly new style of plan.
Is there any literature that can be found on your internet? Or?
We do have information on the MVP website regarding that particular product, and I have meetings specifically for that particular product.
Okay, thank you.
I don't know whether or not Aetna or...
Yes, Aetna currently does not offer an MSA plan, a medical savings account plan.
And Excelis?
We do not offer an MSA plan at Excelis.
Okay.
Morning. I'm covered under my wife's still working, I'm covered under her insurance. And she's going to be retiring next year. My question is, since Medicare seems to be going up next year for first-time subscribers, should I join this year? I'm under A, but that's it. Should I sign up for B and drug coverage this year, or should I wait till she retires?
The question sounds to me like you're wondering whether it would be advantageous for you to sign up for Part B Medicare. Since you're covered under your wife's plan and the company size is over 20 employees, you've waived your Part B Medicare. My suspicion is that the drug benefits are already built into your wife's plan, so you wouldn't want to worry about signing up for a drug plan. But the question sounds more specific to Medicare Part B, whether or not the premium increase will be beneficial for you to sign up for this year. Unfortunately, the actual decision has not been finalized, so that's not something that I feel comfortable really answering for you. However, it may be a good idea for you to talk to a financial advisor and ask them what their feeling is, because if it does go through and you're subject to that increase down the road, you may have regretted not signing up. So I would direct you to your financial advisor for that question.
I note for folks standing, there are some seats. There's a few here, there's one back there, so please feel free. Right.
I got in touch with 2 out of 3 of your companies, and 2 out of 3 of your companies gave me erroneous information that cost me money. So between you guys and all of us in the room, is there like a person or a number that we could get in touch with if we feel like maybe we're not getting the right information?
Yeah, absolutely. I mentioned Nextdoor before, and I come from the independent insurance world background and association background. That's what I have, and I have a passion for agents that work independently. So a lot of the agents in the area, they work independently. They represent all of our companies, and a lot of times that is the best place for you to go to get that kind of information. You know, they don't get paid anymore. They have to. It's all going to be an equal commission type thing for them, but they can sit with you and spend that quality time with you in your homes, in meetings, and go line by line by line over the benefits and the needs that you have. Everybody's health is different, everybody's benefit needs are different, and I would just really, really suggest. We also all have great member service departments that I know, you can contact the member service departments for any kind of member service questions you may have, but specifically to what plan fits my needs best. It's my personal opinion, but I do believe in sitting with an independent agent and having them help you out and spend that quality time that you deserve.
And along that lines, I just want to remind that the independent agents are wonderful, but they do not represent the Excelis Medicare Advantage plans direct. I'm here to help with that. If you'd like to come and ask me for a business card, I'll be happy to give it to you. I also can meet with you face-to-face, review the details of your specific needs, and select a plan that makes the most sense for you in 2016.
I just want to add one thing, ma'am. It sounded like you were asking if there was a place you could file your concern regarding the erroneous information. Is that correct?
Well,
she did ask that, yeah.
I was primarily trying to find out because I knew when I was given this erroneous information, it didn't make sense.
Okay.
And if I had known a place in a company to call, and in fact I called one of your companies to try to find that out, I was on hold for over an hour, and then I got the recording saying that you were only open from 8:30 to 5 and a call back during business hours. This was at 3 o'clock.
What I can tell you in these scenarios, under all Medicare Advantage plans, you have the right to file an appeal or a grievance, and that gets reviewed by an outside agency, not the insurance company themselves. So every company is required to have access for their members to file complaints, and that has to be reviewed in a timely manner. That would be for you to contact that insurance company directly to determine, whether it's been too long since that claim was filed or not. But we are governed by Medicare, and we are required to have that option available to you.
Thank you.
Good morning. My question has to do with the Excelis Value Plus plan that I have. If I'm traveling out of state for a month or two, or whatever. My question has to do with the maximum out-of-pocket expenses. I understand under the Obamacare now that even though you're out of state, and this is an HMO for the Rochester area, there's a maximum coverage. If you had to go in, besides emergency, into a hospital, you're still covered. And I'm getting mixed reviews from different people I talk to. Can you explain that a little further?
I can try to explain this, but in a vanilla fashion. The reason why is we're not really here to discuss specific plan information. So what I can advise is that it sounds like what you have is an HMO. That stands for Health Maintenance Organization. So with an HMO plan, you are required to schedule planned services within the network. And then if you have an out-of-pocket maximum with your HMO, those planned services that are covered under the plan would count towards your out-of-pocket. But the question here has to do with an emergency situation. And I know nobody here has ever planned an emergency. And with most HMOs, you are covered worldwide in the event of an emergency, and you can also access urgent care centers nationwide. So those services that are not planned wouldn't count towards the out-of-pocket on an HMO. So that, again, that's a vanilla answer. If you have more specific questions about your Value Plus, please come see me. I'll be happy to help.
I have a question about the hospitalization. If you the Medicare Advantage plans are cooperating with Medicare Part A in this regard, and I think. And the deductible is $1,260 for hospitalization in Medicare Part A, and then some of the plans charge more than that. Do they cooperate in that? Like, WellCare charges $590 a day for 3 days, and that comes up to almost $2,000. So.
I can speak to that. The general rule with all Advantage plans is the whole plan has to be better than Medicare. There can at times be a specific benefit that is not quite as good as what Medicare offers, but when you look at the big picture of the full Advantage plan, there's going to be copays where Medicare Part B was charging percentages. The general understanding is that the Advantage plan as a whole is better than Medicare as a whole, but you can have small scenarios where a specific benefit is not quite as good as what you would get with original Medicare. Does that answer your question, ma'am?
So a question over here? So, yes.
I was just wondering, if you had to go out of state and that you had some serious disease and there's nobody here that can take care of you and you have to be out of state, is there any type of coverage that either one of your plans offer?
Those of us that do have the PPO, the Preferred Provider Organization national networks, that's when you would utilize a benefit like that. So anywhere that you have a network that covers you from state to state, not just for emergencies, but if you so choose to go for a second opinion, or you have a doctor that you maybe want to see in Florida or North Carolina or someplace like that, you certainly can utilize that coverage that way. It's not just for emergencies and cases like that.
Just saying for the extended, like you've got, 6 months you can leave the state with your insurance? Mm-hmm. And if that time you're being under care, would any of that be covered?
Yes, absolutely. You would utilize it just the way you would your in-network benefits. Here, if you were using an in-network provider in another state, it would be covered the same way that it would be covered right here in Rochester. If you decided to use an out-of-network provider, wherever it was in the country as well, you'd have that coverage too. You use your out-of-network benefits that way, but the coverage would be there.
Up to what amount? Up to this set amount?
Yes, there's a ceiling or an out-of-pocket maximum that they have on each, on the in-network side and on the out-of-network side.
And that would be a PPO, you said?
Yes.
Okay, thank you.
I would like to elaborate a little bit on that, in that you started your question by asking if there was no services available locally that could treat you. In the MVP scenario, it's rare. We're very lucky with the hospitals we have in this region. They can usually treat everything. But there are some unique scenarios where an individual has a rare form of cancer or whatever, and there's only 1 or 2 experts in the country. In that scenario, you'd work with your primary care physician or the specialist, and we would set up a referral to approve you as in-network to go out of area. And that only happens in a scenario where we don't have the expertise available in this region. Obviously that's rare, but it does happen.
Excellus has the same sort of opportunity. If there's absolutely no doctor at all that can treat you for your condition and you have to leave town, then a request could be made for an exception as long as it's medically necessary. Another way to consider that sort of coverage would be to consider a Medigap plan. Excellus does offer Medigap plans. Medigap plans work hand in hand with original Medicare, so you're using your original Medicare Part A and Part B, and then you're buying insurance that pays those co-insurances, co-pays, and deductibles that are under original Medicare. And original Medicare has a national network of providers, and if you do go with a Medigap plan, be sure you pick up a standalone drug plan. This way you're not subject to the Part D late enrollment penalty down the road.
Okay, I have a question about the out-of-pocket expenses. Yeah, how do you pay the $6,700, for instance, if you are on low income?
It sounds like an Excellus question. Do you have 6,700?
Or
So
whatever.
the question the question has to do with specific benefit questions. So again, I'm going to answer in a very vanilla way because we aren't really talking about plan specific. So when you have an out-of-pocket maximum, the way you meet that is by going along and paying your cost share for medical expenses. Not pharmacy benefits though, because the donut hole applies. That's different. So if you go to the doctor and you have a copay, let's say it's a $5 copay. That $5 will then go towards the out-of-pocket maximum. And so you have to spend a lot of dollars in copays to meet the out-of-pocket maximum. The out-of-pocket maximum is not a deductible. You don't pay it first. You pay as you go. And if you should have a very sick year and you do hit the out-of-pocket maximum, then that means you're protected from any sort of medical cost shares for the remainder of that calendar year. You're covered in full for covered services that are medically necessary if you hit the out-of-pocket maximum.
A lot of the hospitals also have charitable programs. So if you get into the hospital and you are low income, I know Strong has a program that will help people to pay those copays as well. So for the lower income people, those are things you want to work with a social worker on to see if there's any help available.
You talk about the United States. Are you covered in Canada?
Original Medicare network is national, so no.
So what happens if I get a heart attack in Canada?
Well, if you're on a Medicare Advantage plan, the good news is you're covered worldwide in emergency situations. So a heart attack is nothing you plan. That's an emergency. You would be covered as though you were in the network.
Thank you.
Yes, I have two questions. One is a second opinion on anything, an operation, whatever it might be. Can you select any doctor you want and just pay the copay?
I'm speaking, again, not product-wise, but specifically with MVP. We do not require referrals to see a specialist at all. So as long as your specialist is, especially if you have a PPO plan, which gives you in and out of network benefits, you can have 2 consultations with oncologists in this area. And if you wanted to go to Sloan Kettering, for example, and get a third opinion, that would be considered out of network, but we do not have a referral process, so you would be permitted to do that.
The same is true for.
Another copay then.
You pay co-payments each time you go, that's correct.
All right. The other thing is I've received a list of drugs and drug tier from Excellus. Are those same drugs the same throughout the different companies?
Tiers can vary from company to company. It's very important that you don't just assume that because your current company has a tier 1, that the company you're considering, that prescription's also a tier 1. Each of our companies will have a specific formulary, and those tiers can change from company to company.
So I'd have to go to each individual company to find out what their tiers are?
Yes, sir.
So by the same token, can the percents, when you cover percents instead of flat, can that vary from company to company in terms of the original price, the percent of what? So like if you have an MRI and it says 20%.
You'd need to look at each plan. Yeah, each plan that each company has can be different. I mean, if you offer different plans within a company, they can certainly differ. So you want to be sure to look at those, yeah.
In reference to the woman who mentioned if she had a heart attack in Canada, I do some international travel, and I know most of the times when you leave a hospital, they ask for payment. So I or she would be responsible to pay that hospital and then be reimbursed?
That's correct, up to what your copay would be if you were in the area.
That could be substantial if you had an emergency overseas.
Typically overseas, if it's a urgent care visit where it's a low cost item, you would pay up front, submit the receipt to the insurance company. I think we all have currency exchange systems, and we would do that. If it was a more severe scenario, I had a client that was in hospital in Italy for several days. In that scenario, you call your primary care physician, and they'll usually work with the insurance company to get up some sort of setup so you're not out of pocket, $10,000, let's say. The smaller ticket items, I would definitely think you would normally overseas pay those out of pocket. The larger ones, typically, the insurance companies will work with that provider overseas to set it up.
Let's back up to the tiers, if we may, please. Is there one place where we could get the list of all the drugs under tier 1 through 5 or higher if it goes for all of the health insurance companies?
Unfortunately, that's not information that anybody has taken the time to compile, a side-by-side comparison of formularies. But what you can do is reach out to each individual carrier and request them to send you an enrollment kit where you'll find all the benefits and a formulary. And then it really will be up to you to do your homework and write down all your drugs and look up the tiers and look up the cost shares to determine which plan makes the most sense for you.
You can call our call centers too. All of us have call centers. You could call and speak to a representative if you don't want to look through alphabetically each prescription. They'll look them up for you. That's always another option.
Thank you.
Some of the Medicare Advantage plans say that you're responsible for approximately 20% or 30%, for instance, of a major analytical event like a CAT scan or MRI. Could you speak to that for a moment, please, and tell me approximately what someone might be looking at? I think it's thousands of dollars, but.
I mean, it's going to depend on the cost of the service itself. So you're right. For those services that require 20%, if it's not something emergency-wise that you can call ahead and kind of discuss with your doctor, discuss with the hospital to find out. It's always something good to know. But from a CAT scan to an MRI to whatever other kind of scan, they vary depending on the service.
Some plans have co-payment structured plans. Some plans have co-insurance structured plans. Those are all things that you do in your comparison to determine what's the appropriate plan for you for that given year. That's a big part of this process.
If you do have a benefit that has a 20% co-insurance, you can try to call ahead of time to speak to the doctor's office and ask them to give you the CPT code, and that's a procedure code that the doctor's going to bill for that service, and also ask for a place of service code. You can call customer service and ask them to look up the allowable amount for those CPT codes, and that'll help you budget the 20% so that when you're having those services, you're prepared.
Yes, I just recently sent in my enrollment form for Part B. I'm on Part A. I'm covered through my former employer through the end of the year. I asked for them to start my Part B on January 1st. Now, by doing that, rather than say December 1st of this year, would I be subject to the increase if the Medicare goes up?
We don't know yet. That's the answer we'll give you now. As of now, they have not finalized that answer, so none of us are able to answer that question for you as of this date.
Could you tell me what is the difference between the deadline, which would be, what, December 7th, versus an event? And so that you don't have to worry about getting everything done by this December? Well, I can't be specific. I don't turn.
So it sounds like we need a clarification between an AEP and an SEP. More acronyms. AEP stands for Annual Election Period. SEP stands for Special Election Period. The annual election period is what runs from October 15th until December the 7th. During that time, all individuals who are currently on a direct pay Medicare Advantage plan have an opportunity to review the plans that are out there and select a plan that makes sense for them effective January 1st. As long as they get their application in by December 7th, they can switch their Medicare direct pay plans. An SEP is different. A special election period allows individuals to change plans throughout the year. So if it's February and you're signing up for your Part B Medicare and you're new to Medicare all over again, that's an SEP. You can sign up for a direct pay Medicare Advantage plan in February. If you're moving from California to Rochester in June, that's a special election period. You can change plans during that time. If you have Epic, you can change plans once a year using that one-time SEP.
I also have another acronym, it's ICEP, which is Initial Coverage Election Period. That's for those of you who are not 65 or not on Medicare yet. Those of you turning 65, let's say in March or April, you will have the 3 months prior to your birthday, the month of your birthday, and the 3 months after to make your initial coverage election period because you're turning 65. So that is a different time or a different election period for those just going on Medicare. Typically there's annual election period, that's the time of year we're in right now. The special election periods, as Susan talked about. But what's also known is the ICEP, which is the initial coverage election period. That is the time for people who are new to Medicare, they're new Medicare recipients. Those Medicare recipients, let's say your birthday was July 23rd. Your Medicare will normally begin on July 1st, but you'll have the 3 months prior to July, the month of July, and the 3 months after to make a plan selection. That following year, you would be subject to the annual election period like everybody else. So this is the one time that you get a little extra time to make your mind up because you're just turning 65 or just going on Medicare, maybe for disability purposes.
So that's a 7-month period.
It's a
the month you're
7-month.
born in, and 3 months prior, 3 months after your birthday.
Correct. That's the first and only time you get that 7 months, only when you're just turning 65.
This is for MVP. I went on the website to see if my doctor was in your plan. And I have MVP now, and he's in my plan now, and your website says he is not. Now, wait a minute. I'm checking different plans.
Sure.
If I'm looking at, let's say I wasn't in your plan, and I says, well, my doctor's not in your plan, I'm not even going to you.
I would agree with that. Let's put it this way. They have changed the way doctors are structured within offices nowadays. A lot of times there's an office with 12 doctors under that office, and not all of them are going to be listed individually. That does happen with all plans. Our recommendation, especially in this county area, because our provider network is so saturated, if you did not see a doctor in the network, we would hopefully request that you call the call center, or more importantly, contact that direct doctor directly and see, do I participate? You're going to see this more and more with nurse practitioners and physician assistants coming in because they're not always listed under the book as the same way as a standard specialist may be, and that can happen.
But that's a good point. Just because you're in a practice, it does not mean all the providers in that practice are in network. Is that
No,
right?
in our case, we do contract with the entire practice in most scenarios, but they may not be listed individually. So if you don't see the doctor, call us or call the doctor before you make the assumption that they do not participate.
Yes, doesn't that also apply if your particular doctor is not taking any more patients?
I can't speak to every family practitioner, but there is a lot of family doctors, especially in this area, that are not accepting new patients. So
their name is
they,
not in the
we
directory.
may not list them. In that case, that can happen as well. Yes, ma'am.
I feel like an auctioneer, going once, going twice. Well, look, I appreciate. Oh, I'm sorry. I almost pulled the trigger too quickly.
Back a couple of questions ago when you were talking about the selection time period, if the person had their birthday in July, as you were speaking, and they chose, would that be for the calendar year that they are in at that time? And then they would have to choose again in this October, December timeframe, so they'd be choosing twice in the same year, once for their current year, once for the succeeding year.
To kind of elaborate on the initial coverage election period, you would be making a decision to begin, let's say you made a decision in April and your birthday was in July. The April decision would not take effect until July 1st. That decision would most likely be the decision you made for the remainder of, let's say, 2016. But during 2016, October 15th through December 7th, you would be given an opportunity to switch plans and go to a different carrier or a different insurance product within the plans. If you like your plan, you don't need to do anything. There's no paperwork involved. You just keep it.
I don't know if you know the answer to this, but is that something that we should sign up for even if we don't need it? Or should we only take advantage of it when the time comes?
So you can sign up for Epic anytime as long as you're eligible. The income limit is $100,000 for a married couple, $75,000 for a single person. Epic can not only help you with the cost of your drugs at the pharmacy, but it can serve as a one-time special election throughout the year. So it just makes sense to have the Epic ID card. It's free as long as you're using the deductible plan, and it's just something that you can use as a sort of get-out-of-jail-free card. If you've ever played Monopoly, you're familiar with that. You can switch plans one time throughout the year. If you've picked a plan that doesn't make sense for you because your circumstances have changed, switch plans with your Epic special election.
Well, look, it's just a few minutes before 11:30, and I want to again apologize for people who had to stand and for not getting material, which we will send out. We will schedule another event, although hopefully you've gotten a fair amount of information. But could you give our three panelists a round of applause? And if you could give our interpreter, John, whose arms are probably falling off, a round of applause as well. And we'll be sticking around as the panelists may be as well, so you should feel free to chat. But again, thank you very much for being here. Hope this answers some of your questions.